No, there was a father and a son traveling in a car. Unfortunately, they get into a car accident.
Rushed to the hospital, but on the way to the hospital, the man dies.
So then they rushed the boy into the surgery to see if they could save him.
So the surgeon takes one look at him and says, I can't operate on this boy, he's my son.
Who is the surgeon?
I've heard this before, but I don't remember the answer.
The boy?
Other father?
The surgeon could actually be the father.
This is probably the hardest riddle I've ever had before.
And then by the patient bedside, after we finished, like, you know, examining the patient, talking to him about his management plan, he like just stuck his hands in there and like then like ran off. Like he knew he had done something, like a naughty kind of toddler situation.
Who is Annabel? What do you do? And what makes you tick?
So I am Dr. Annabel Sowemimo. I am a sexual reproductive health doctor. So that means that I do gynecology, which includes like dealing with menstrual issues as well as contraception, sexual health, and dealing with also difficulties in terms of assault and more difficult things like that. When I'm not doing my usual sexual reproductive health work, I also run an organisation, a non-profit called Decolonising Contraception, which takes up a lot of my time talking about the history and the unethical history of medicine, mainly within reproductive health, but also within medicine, which we've seen is a really big issue, especially around COVID.
So, I'm interested in the name that you gave your organisation, Decolonising Contraception.
Yeah.
Why did you choose that name?
So I think decolonising has very much become a buzzword, and it's a word that's existed for decades. It was used by historians, very much talking about like the decolonial period of countries, usually that have been colonised by European countries, and that was like their way of discussing some of those issues. And obviously we've seen it transition into this word of activism, and it's still like a term that's still being developed. Contraception obviously is in its essence a way to stop getting pregnant, and it's been used historically on different populations under the idea that there's too many people reproducing, and has associations like with eugenics. But at the heart, it's also something liberating, so a lot of people don't want to have children, or have had too many children, or they have a family already and they want to be able to go out and work and support their family. So it's supposed to be a way of taking back autonomy.
Let's just go a little bit more into the idea of hair and the workplace.
Yes.
So have you ever felt pressure to change your hair for your workplace?
So even though sometimes within the workplace or whatever I can see or feel like it makes me stick out, I'm very committed to just being like my authentic self. But there definitely been moments like colleagues touching my hair. I had a colleague once, we're at a patient's bedside. It was my first year out of medical school, and he was like looking at me really intently. I hadn't worked with this particular individual before. It was a consultant, so much more senior than me. And he obviously looked so fascinated by my hair. And I could tell he was looking, but I just thought nothing of it. And then by the patient bedside, after we finished examining the patient, talking to him about his management plan, he like just stuck his hands in there and then ran off. Like he knew he had done something, like a naughty kind of toddler situation.
What would you say then to, British workforce, the employers generally, about, making the workplace a place where we, as black women, we can feel like we belong?
We know that we're different, do you know what I mean? But in terms of we are in the minority, that's clear. But it's about not making that person feel like they're a problem. Because the other thing is it shouldn't be about this, but it allows that person to be the best version of themselves at their job, right? They are comfortable and feel like they can just get on with what they are doing, rather than thinking about the fact that they're having to adapt and assimilate to not upset other people.
We've intertwined for hundreds of years now, right? And I think white people should really know that, okay, yes, black people's hair don't grow like theirs. It's different. You know, why is it now in the 21st century, it's oil, you know, it's still, ooh, look at them, they're different, when we have been interacting. And I feel a lot of that is the lack of representation.
I can't remember who precisely said this, but someone said, especially in America, that black populations know a lot about white people comparatively because they worked in their homes, they looked after their kids. And if you think about societies that have been very recently segregated, like in apartheid South Africa, that's very, very clear. But the reverse is not true, okay? Because there's not a need for somebody to understand black hair. For black people, we have to understand white hair because of the society that we live in. It's a necessity for us to kind of progress and be that we have an understanding of like whiteness and Europeanness, especially when you're in a minority. Whereas the converse is not true. It doesn't actually matter if a white person doesn't know anything about black hair. Yeah. It doesn't affect them or their chances of survival in any way.
What is the advice you would give to a young black girl who probably, well, not probably, is looking into, you know, studying medicine or any other STEM, you know, subject, and feels anxious about her hair and reception that she will get? What would you tell her?
I feel like the time is now for people to not compromise themselves, because firstly, you diminish yourself the more you compromise yourself, right? So you might feel like, oh, if I relax my hair, or if that's what you want to do, that's fine. But if you're doing things that are not for you to please other people, at some point you start to feel oppressed by it. You know, if you're thinking about how can you get ahead, or how can you just, you know, get the furthest that you want to get to for your own self and for your career and feeling, you know, happy in life, it's always going to be by being your authentic self, because in the end you're going to be like, that was a life worth living because I was my authentic self. I felt comfortable in my skin every day and I didn't compromise for anybody. I have to do what makes you feel comfortable, confident, and happy. Yeah. And if you're stripping any of that away to please other people, move on.
Move on. Thank you so much. I really enjoy that.
I have no idea. I can't lie to you.
The mother.
That was very simple. I understand how I didn't get that.
The mother. You're too clever.
That was very simple. I understand how I didn't get that.
His mom.
Okay.
Yeah. You got me, okay.